I have Penny and Greg. Welcome to the show, Penny and Greg.
Thank you. So glad to
Thank
be
you.
here.
Glad
Yes,
to
we
see you.
are.
Yes, and Laura with prescribinglife.com. Welcome, Laura.
Oh, Melissa, thank you so much for having me here again. Thank you.
Yes. So this is an amazing story, you guys. This is something I just, I really do believe we're living in Jesus time now, where we're seeing the healing right and left. And I know I'm probably not supposed to use that word, but okay, sue me, right? I'm just seeing people get better, whatever you want to call it. People are getting well, and it's so amazing. And Greg has had multiple sclerosis. And this is, of course, if you don't know about this, this is nerve damage. I'm going to ask them about it, but this is what he has had treatment for. And he is just a living testimony that this is, the people are getting better. People are having their lives back. Am I right, Mr. Greg?
It is absolutely amazing.
I'm so excited to hear this. We've been talking, Laura and I talk a lot, and she had told me about this patient, and she wanted me to meet him, Greg, and his beautiful wife, Penny. And so I'm going to ask them some questions about what exactly has happened. First of all, I'd like to, you had some history before that. So tell us what was going on before, whoever wants to tell the story.
I'll start it off, and then she can take over when I mess up. So I started several years back with a lower back injury that repeated itself over and over. And so every time I would get a statement from whoever, it would say what medications I was on, and nothing really worked. And then it got worse and worse. And then we went to specialists, neurosurgeons, um, you name it, chiropractor, everything that everybody you think would try if they needed to. And then at that point, I was pretty much done with it, kind of saying, "Is this how I'm going to live?" And this one said, "I know where you need to go." And I said, "No, we've already done everything."
And we had facet injections too.
Oh, yeah.
He had 3 rounds of facet injections in the back, to the point where that was as far as we could go. They said we can't do anymore. And so the next thing, the next step is surgery. So he jumped right to, and we decided, I found your story. I already knew your story about your mother. And I said, what have we got to lose, right? There's this place in Houston. Let's load up and go. And that's what we did. We found Prescribing Life, and it has been just a miracle for us, an answer to prayer.
Well,
is
and
all I
that's
can say.
one of the things that has been typical is that most doctors say, well, this is everything we can do. This is all we can do. And this is just your plight, and just accept it, type of thing. And that happened in my personal life. It happened with my mother. It's happened with you. It's happened with so many people, but that's not the case. Am I right, Dr. Laura?
Yeah, well, Melissa, I'm just, thankful to be able to do what we do. I think everybody tries to do their best, or most people in their profession, they're just trying to do what they know and what they have been taught. So I'm just very grateful and thankful that we're able to do something that not many people know, but that it really helps, and that it doesn't have side effects, that it's very safe, and that we can see results very quickly. So
yeah. And it's just so much hope. That's what I really appreciate about you, is that you really, and your faith, because you always remind us that God made our bodies amazing, and our bodies, if you just give them a fighting chance, they can be healed. God created us to self-heal. And so that's really what this is about. This is about neural therapy, you guys, NEURAL therapy, nerve therapy. And I think of it like okay, this is my newest way to describe neural therapy. This is where it's like, if you've ever had a split end, ladies, right? And the guys, I don't think you have any split ends, Greg, but anyway, you have split ends, right? Where they fray, your hair can fray if you burn it with a curling iron, whatever. And so you put conditioner on it to help it to go back together. Kind of. Anyway, so this is what kind of, I think, neural therapy kind of does. It goes in, and especially if you have what you're going to talk about here in a minute with the multiple sclerosis, is that your nerves are frayed and damaged, and the coating, the covering on the nerves is damaged, and it can just go in and like condition them. I don't know if that's right, Laura, but that's what I think it's kind of doing in there. Somehow or another, these small injections of just this easy, it's nothing difficult to put on in there. It just seems like it makes them happy. Am I right?
That's right.
I think it's a good metaphor, because at the end of the day, what it's doing is repairing the nerve tissue, and that's what we're doing. That's what we're helping to do, and encouraging your body to go through that process, because, as you said, our body has the ability to heal itself. We just need to put it in the right path to do that. And that's what neurotherapy is all about.
Right. And so if you can imagine, it's frayed, it's not going to be able to send the signal properly. And so,
Correct.
so if you have scar tissue and it's all, you know, and the message can't get through that scar tissue, what are y'all doing? Are y'all laughing at me? Anyway, and what happened? She
The
threw some.
sweeper turned on automatically.
We're turned on our robo sweeper.
Oh, yeah, he's coming in. He wants to be part of the show. Anyway, it's right. It's just and over our lifetimes, we have different things like your back surgery, like different things. And that's exactly what happened with my mom, is that has damaged the nerves. And so that there's scar tissue, and it's really messing up the pathways for the signals to travel on. Right.
Okay.
All right. So tell us, fast forward to us, tell us, okay. Then did you go to Dr. Laura? Okay. For your back pain, right?
3 trips. We did 3 separate trips because we could only stay for a week at a time because of our jobs. And so we would come down for a week. And I mean, honestly, let me say, for the first, like when she gave him his very first injection, it was like a different person. Like his face relaxed. He was in so much pain, on so much medication. And it was just after the first injection. And it got just better after that. She's just like, you know, you're going to get progressively better, but you can only do so much in a week. We did 3 trips to Houston. By the 3rd trip, we were complete. From that point until actually we had this procedure done, we had no pain. There was no pain after that. Laura didn't see us for a year or more, right, Laura?
Yeah,
because that was healed. Like we were done with the back pain. It truly was miraculous. And I think we didn't know at that time that he had MS. And so between that point in time until the next round of when things kind of went really bad, we found out he had MS in between that time frame. Okay. And so in regards to that, he had MS, and they wanted to do a nerve or no, a bone biopsy, because they wanted to rule out some different things. And we knew better, but you know, we were following.
It's supposed to be a standard procedure that everybody does. They used to do it in the office kind of thing. And it didn't turn out well for me, but
Yes,
everybody's different.
right. And so after that, we knew at that point in time when he had that procedure done, he could tell you the hour, I think the minute or the second that it happened. When they drilled into the bone, they went through a nerve bundle, like on like sciatica. And we knew at that point, he walked out saying something bad has happened. And so.
Can I describe
Yeah,
that one?
yeah.
So when this girl decided to get me down here the second time, it wasn't as hard as the first time.
Yeah.
I said, I know where you're going too.
Right.
Yeah.
Get in the car.
But we felt helpless again, because we did, you know, we did everything they told us to do. And it wasn't the procedure. It was, you know, things happen, and it wasn't that. It really was your MS and blah, blah, blah. And so I called Laura, and we were at the end of our rope. And I said, Laura, I need help. If you think you can help us, like, I need you to be 100% honest with me. Is this something you can fix? And we explained it to her, and she said, I think I could fix this, but you've got to commit to like intensive, like we stayed for a month. We stayed for a month. He went twice a day. And I mean, we were all in with diet, with the procedures. Laura put us on a path. And I will tell you, by the first week, he was in such pain to begin with, and he was on all kinds of pain medication. When I saw him after he came, he had flown here a week early, and I drove. But when it was not even the same person when I saw him just after a week. And then we were here for a month. And it was just to see the healing take place. And that's why I would just encourage, there's no reason to be hopeless. Amen. Because Laura's here, and God is here, like waiting for you to, and her father is here as well. Harold. I don't. But anyway, but between both of them working, I can't even tell you like the difference in his health. And with MS, like, you know, you have, it is a, you know, and we don't even like to call it that. Like your dad doesn't even like to call it that, because your body can heal itself. And I have seen healing miraculous healing occur, where MS doctors would never tell you that this could happen.
No,
And so
no.
that's where
And they don't, I guess they don't know. All they know is what they've been taught from the AMA.
that's right. That's right.
And, yeah. So so somehow or another, this miraculous treatment restores the nerves that have been damaged. I mean, I don't even, that's just, it's amazing. Even with multiple sclerosis, again, the sclera of the nerves, you guys, is the covering, and it's fraying off of the nerves. Imagine the pain. It must be absolutely excruciating and beyond words to describe. And so amazing to have this just become where it's actually functioning again. Am I saying this right, Dr. Laura?
I think you are, but I would like also when Greg can explain better, because he's who he was having the symptoms, and Penny's right also that we don't like to mention diagnosis, not because they exist or not, but because they put us in a mindset that if I have this diagnosis, that means these are the consequences of this diagnosis, and it leads us to that path. However, if we start looking into multiple possibilities, and that not really there's just one path is telling you this disease has no cure, and also it will be degenerative, so there is no way that you can get better. But then when you can see how your body can restore in many different ways and so quickly, like we have witnessed with Greg, and I remember the first day he was back in the clinic again, or the second week, he saw my father as well. And my dad actually started doing a physical examination to him that Greg was saying, I've never, I've been in, I don't know how many neurologists.
My pain's not there, my pain's here.
Right. And nobody has been ever asked me these questions or asked me to do those things. And those are actually where my problems are, my neurological issues have been. And those all started to get addressed, because for us, we're not treating pain, or we're not treating an arm or a shoulder, but it's a human being, and every symptom is related and connected. So to be able to fix that, what we're doing is simply giving your body the information that it needs through their nervous system that is extremely powerful to be able to restore. And our body has that ability. The nervous system is super quick. We send a signal. We're thinking about something. I'm thinking about talking and I'm doing it. And I don't know how that's happening, right? So
right, it's amazing, right?
Exactly. So just like a signal can be sent that quickly, a signal like pain can be changed in the same way. Right. And that's what we sometimes. Right. So that's important, and that's that you were talking about.
So just so you know, we've been we were talking about interviewing you, and she was saying what was so really great, because her father has been doing neurotherapy treatments for 30-something years, right? Okay. And so he's seen it all, really, and so and it's helped so many people to be healed. You know, they don't have. I'm just guessing that they don't have, the insurance or the money in Colombia to do this fancy high dollar, whatever things that they were doing to you. They see someone coming with insurance. They're like, oh, yay, we got someone with a big sack of money. Anyway, but that's not probably what was happening with a lot of people that your dad worked with in Colombia. They didn't have an option of that. And actually, it's a blessing in disguise. Really. Mm-hmm. And so that he's seen such a thing as this before. So you were he said to walk down the hall with your eyes closed. Is that right?
Yeah. Yes. He told me to do that, and he first walk and then walk with my eyes closed, and I'm thinking I've got this down pat, and 2 steps, and maybe 3, I hit the right wall, and I closed my eyes and looked back, and they were looking at me. And said,
are you drunk?
I felt like it, but I thought I had it anyway. So then, the next part of that story is, and he did a treatment on me, and I think it was 10 minutes, probably 30 minutes total, from start to finish, from the first walk to the second walk. I did the same thing, and I walked straight down, and there's one of the witnesses right there, and didn't want to do it over and over and over again.
That's amazing. That's amazing.
Yeah.
Yeah. So really,
it is because that is quality of life for us. It can sound like this is something so small, but it's actually saying so much about your neurological system and about how your brain is functioning. And Greg was explaining to me how that was for him something he didn't realize, but it was there with him all the time. So even in the shower, it was hard for him to close his eyes sometimes because he couldn't
find. So disoriented.
Exactly. So just going back to having the ability to be confident with your eyes closed, it's major if you think about it. And that's what life is about. Having those little moments in that you feel you have quality of life because you're able to do the things that you want to do, including that.
That's right.
That's amazing.
And that's without medication, other than the treatment. And that's where I think, I feel, we bought into, like you said, it can be degenerative and there's no coming back. And, you can really get depressed about that. You know what I mean? And you think we're too young for this. We don't want this to happen. And I think so many people fall into that bucket. And I think we're here to say, like, there's hope. And I really believe that if you at least talk to Dr. Laura and see if she can help you, because it's hope.
Yes.
That's what we didn't have before. We have hope.
That's right.
And that's what Prescribing Life gave us.
Right. Go ahead.
100%. And I'm thankful for this one for making me come here. She didn't have to do it twice.
And I thank you, Melissa. It's like it comes full circle, because we found you, and I really, would never have known about this had I not heard your mom's story and really just, really walked through that with you.
Right.
So, and I've heard so many, people who have been touched by Dr. Laura. So,
yeah,
we're blessed, Laura. You bless us.
Yes, we love you so much. Yes, it's so fun to get to be a part of all this. It's just so fun for me. And my mom really likes being, just knowing that what she went through, which was really, really, really tough, that it has blessed so many people. And so that really, it's really turns those lemons into lemonade. But with mine, I say exactly what you're saying. I went to 2 different doctors, and they were both saying that I was always going to be sick the rest of my life. I had congestive heart failure, and this is basically, this is a turning point in my life. And I did not believe that. I think so much starts with our belief. What do we
Amen.
believe? And
That's right.
and I believed that God had another way, and that He had a different plan, and that He was going to show me the way. And so I am no longer in heart failure. My heart is no longer enlarged. Praise the Lord. And that they were wrong, and in one sense they were right, because if I had followed them and if I had believed them, that what they said, I was going to go down this path, and I was going to be, sick and probably have an early grave. But now I'm doing amazing, and it's really about our belief and really asking the Lord to guide us on what does He want us to do, and listening to Him and following Him, and sometimes following your wife, listening to the Lord, and where she's dragging you to say, this is what we're going to do. Right. And so,
yes. And it's not just me. When I have the opportunity in the waiting room at the office to see or talk with patients when I'm going in, that I get to hear their stories, and it's very similar. So that to me gives me even more hope for family members and friends and neighbors.
Yes. Very, very
here. Hope is here.
Yes.
Yeah. Hope is here.
Yes. Is there anything else, Laura, that you feel like that we missed, that we need to make sure to share?
I think I would just like to emphasize that, like you guys said, every patient is different. So it's very important to know your case. But really what we want to see, if there is anything we can do, we're here for you. So it'll be great to have a call and to discuss the case. But most of the people that we talk to are candidates for the treatment. So I think you're right. There is hope, and there are other things. There is not just the solutions they give you. There are other options.
Yes.
That's right.
Yes. Yeah. Yes. So Greg, would you say that you have only 20% symptoms, or what would you say is your current status?
I'd say my back's 100% good, and my hip is good unless I do too much walking, because I can walk now, and sometimes she says I overdo it.
As does your dad, Laura.
And that's right.
Right.
Yes, it's all good, and nothing like it was before. I mean,
so you don't feel like you have any symptoms of the multiple sclerosis?
Of the MS? No,
right.
This is the biopsy part I'm talking about. It creeps up if I'm doing things, running or something like that I'm jumping into.
Right.
But it doesn't last long, and it's I can tell every day is better and better and better.
Yes, that's wonderful. That's so wonderful. Okay, one other quick thing. I was actually reading a book trying to help a friend of mine who has the bipolar disorder, and that's a neurological disorder. And actually, in the book, it said that one of the treatments is neural therapy. I was like, look at that, right here in this book. So it's I think because so much of our systems, whether it's mental, physical, whatever, is the issue is neurological. And so if we can get the nerves, send the right message, and stop the interference fields, stop the stopping up of the wave of the messages getting through, we can just keep this train rolling and get everybody well. I'm ready for healing. I'm ready for 1,000 years of peace and health. How about that? 1,000 years,
Us too.
all of it. I want
Yes,
for 1,000 years.
I love it.
Okay, let's.